am going to have Siggy Flicker. She's one of the housewives of New Jersey, and Dolores Katina. She's also a housewife from New Jersey, from the show, the Bravo show. And Siggy has a new book out, and she's a relationship expert. So we're going to learn how to improve the relationship you're in, or how to find a guy if you need one. And she's very funny, she's very entertaining, so that's going to be a great show. Okay, what I've done here is I've brought a lot of vendors in and some doctors, and we're going to be doing procedures on site. And our star attraction for this evening is Dr. Christopher Pittman. He's an interventional radiologist from Tampa. And the reason I brought him over here to Boca Raton is that he has a procedure to remove hand veins. He did it on me about a year and a half ago. And of all the cosmetic procedures I've done, that one is the most impressive, because I used to have really unbelievably big, bulging, purple veins, and Dr. Pittman got rid of them. So do you want to tell us exactly how this procedure works?
Well, it works very well, Becky.
Yeah, I know that.
It works 100% of the time. It can look better in people within days, sometimes weeks, sometimes months, but it's an extremely effective procedure. There's no surgery, there's no blood. We use a needle the size of a hair shaft.
It was very simple, and no pain at all, nothing. The needle was very flexible and very, very
the size
tiny.
of a hair shaft. No one's ever hit us cussed or left for anything that we do in our office.
And I have to introduce is this your medical assistant?
Yes.
Okay.
This is my medical assistant, Mike Davis. He's a master's in medical science out of USF, and he's my medical assistant on steroids.
Mm-hmm. All right. I guess that means you're good.
One of several.
And this is Karen Pittman. This is Karen Pittman.
Oh, hi. How are you? I am the VP of Business Development for Maine 911, but I had my hands done also, and it doesn't hurt. And veins are a sign of age, so when I found that out, I wanted it taken away immediately.
Okay, so this procedure, I went to Tampa, and I think you really only had to do one time on me, right? I don't think I had to come back for follow-up, and immediately they looked better. But over the course of several months, they looked even better and better. And I really can't believe it, because I have no veins in my hands.
Yeah.
So, okay.
Becky had some quite bulging veins, not becoming the
No, they were awful. I was always hiding my hands.
Beautiful lady that she is. And we use a sclerosant. It basically irritates the lining of the vein, and it makes the vein scar up and go away. Your body takes it away. We don't take it away. We just induce the vein to be absorbed by your body.
So what you're doing is you just inject those veins that you want to get rid of.
Yeah.
And it's the same thing that you use to inject leg veins?
It's the same thing that we use to do non-surgical vein care in the legs. Actually, all over the body, we use this to do non-surgical vein treatment. And it's extremely effective. Honestly, you cannot be fully treated medically, and I don't believe you can get a great cosmetic result in leg veins without ultrasound-guided foam sclerotherapy or foam sclerotherapy
and
direct injection.
Ultrasound-guided because he is an interventional radiologist, so...
Yeah, who the heck am I? Am I qualified to do this? I mean,
and a lot of vein doctors don't use that when they do the procedures.
Yeah. We don't use filler. He closes down the vein, and then the vein goes away completely. Yeah. We don't use filler, and it's a one-time procedure. So when he closes down your vein,
they're gone,
and you don't have to continue to come back for filler or anything like that.
Yeah.
And a little bit later on this evening, Dr. Pittman is going to perform this procedure here at my event on a living patient. So
a living patient.
We're going to get to see that live. Okay, I got to move on to my next guest.
All right.
Thank you, Becky.
Thank you very much.
Enjoy the party. Have this